Hi there, I'm Andrea Brognano, and I'm a licensed mental health clinician specializing in anxiety for women. So let's talk about anxiety for women. Women with anxiety may experience physical and emotional symptoms such as worry, irritability, or sleep difficulties that can cause distress and interfere with their ability to fully enjoy their lives. In small doses, anxiety can be beneficial and can motivate you to take action. However, chronic and severe anxiety that interferes with your life can be detrimental and a sign that you might be suffering from an anxiety disorder. Common symptoms of anxiety in women include excessive fear or worry, irritability, changes in behavior, such as avoiding things that might cause anxiety, difficulty focusing or making decisions, feeling restless or on edge, muscle tension, shortness of breath, increased heart rate, upset stomach and nausea, fatigue, dizziness, hot flashes, and difficulty falling or staying asleep. There are many types of anxiety unique to women. Women experience significant hormonal changes during puberty, pregnancy, and menopause that can put them at greater risk for anxiety during these times. Anxiety during pregnancy or the postpartum period is referred to as perinatal anxiety. Some other types of anxiety unique to women include anxiety during puberty. When puberty hits, adolescent girls are more likely than their male counterparts to develop anxiety. Premenstrual dysphoric disorder, or PMDD, involves depressed mood and anxiety during the week before and the first few days of menstruation. Perinatal anxiety. Approximately 6% of women experience anxiety during pregnancy, which is a time marked by significant hormonal changes. The stress of prepping for motherhood and childbirth can also contribute to anxiety during pregnancy. Postpartum anxiety. Around 10% of postpartum women experience anxiety during the first year after giving birth. Anxiety during menopause. Similar to puberty, menopause is another time period that involves significant hormonal changes that can put women at risk of developing anxiety. So, is anxiety more common in women than men? Anxiety is more common among women than men. In fact, women are more than twice as likely to experience anxiety at some point in their lifetime compared to men. Women are also more likely to suffer from more than one anxiety disorder at a time or experience both depression and anxiety. Women are more likely than men to suffer from the following anxiety disorders: generalized anxiety disorder, panic disorder, agoraphobia, and other specific phobias, or post-traumatic stress disorder. Why are women more vulnerable to anxiety than men? Hormones are believed to play a role in why women are more vulnerable to anxiety than men. Changes in estrogen levels during puberty, menstruation, pregnancy, postpartum, and menopause can explain why women are more likely to suffer from anxiety during these time periods. Women also typically have lower levels of testosterone than men, which is also believed to explain these gender differences. Stress is another explanation for why women may be more likely to experience anxiety than men. Girls are more likely than boys to experience traumatic events during childhood, such as sexual, physical, and emotional abuse and neglect. As adults, women experience similar rates of trauma, but at much higher rates of sexual assault. In fact, women are 10 times more likely to experience sexual assault than men. These traumatic experiences can increase the risk of developing anxiety disorders, especially those of PTSD. There are many causes and risk factors of anxiety in women. Anxiety is often caused by a combination of biological and environmental factors. In general, genetics, hormonal changes, and stress can explain why some women develop anxiety. Like men, women who have a family history of anxiety or those who have experienced trauma or other stressful events are more likely to develop anxiety. Women are particularly vulnerable to experience anxiety during puberty, pregnancy, and menopause because these events involve significant hormonal changes. Risk factors are those experiences that increase the likelihood that a person develops a condition. There are several risk factors that can increase the chances of women experiencing anxiety, including family history of anxiety, poor support system, history of physical, emotional, or sexual abuse, diagnosis of polycystic ovarian syndrome, or PCOS, and an avoiding coping style, such as avoiding rather than facing negative emotions, such as not leaving the house for fear of a panic attack outside. Risk factors for anxiety during the perinatal period, such as pregnancy or postpartum, include low income, living with other extended family members, limited support system, having a poor relationship with one's partner, history of anxiety or other mental health condition, family history of mental health issues, experiencing experiencing sleep problems, having a difficult pregnancy or birth, giving birth to multiples, such as twins or triplets. Treatment for anxiety among women typically involves therapy, medication, or a combination of both. There are several different types of therapy and mental health medications that are effective for reducing anxiety. During menopause, women may also receive hormone therapy to help alleviate their anxiety. The type of treatment that is best for you will depend upon how severe and long you have been dealing with the anxiety, the causes of your anxiety, and your own personal preferences. If you are interested in getting help for your anxiety, you could start by talking with your physician or OBGYN. They will help to assess you further, determining whether treatment is necessary and provide you with a referral. You can also search for local mental health providers by contacting your insurance company or doing an online research. The type of provider to look for will depend upon the specific type of treatment that you choose.